See, the time now
is... Only so many facts I can handle at this time of the morning, as you know.
7:42 is the time.
One of the UK's most senior doctors is warning today that our mental health services are overstretched and inadequate, leaving vulnerable people without the care that they need.
A joint investigation by BBC News and Community Care magazine uncovered stories of seriously unwell patients being turned away for lack of hospital space to look after them.
Well, with us now to discuss this is Kerry, who has experience of using mental health services. We can also talk to senior psychiatrist Professor Dinesh Bugra. Very good morning to you both. Kerry, you have had experience of being turned away, haven't you? What is your story?
Well, a lot of difficult things happened in my life, and I tried asking my GP for help, but there's a 17-month waiting list for talking therapies in my area.
A 17-month waiting list?
Yes.
So you go to your GP and say...
I'm feeling suicidal, I'm not coping, and there's a 17th month waiting list.
Did you even think that it was worth going on to a waiting list, which would take more than a year to deal with your problems?
It just seems like by the time you've got through that, then your whole life can have collapsed already.
So what did you do? What action did you take?
Well, things were getting worse and worse, and I was feeling very miserable and confused, and I was getting all sorts of strange ideas, and the voices that I hear most of the time, they got really unpleasant and frightening and distressing. And so one night I felt I couldn't keep myself safe anymore, so I went to accident and emergency, and I saw a psychiatrist there.
And did you get support then?
Well, I'd asked then, please can I go into hospital, because I really don't feel like I keep myself safe outside anymore, just for a few days to sort my head out. And she said no, and there were no beds in New York and no beds in the whole of the northeast of England then. And so I went home, and 3 days later I was still very muddled up and confused, and I did something that was incredibly dangerous, although I didn't realise it at the time, and I very nearly died. And then I had to see another doctor, and the other doctor, he said that I had to go into hospital whether I wanted it or not. I was on the section. And
finally you got the treatment which you'd
I sat in A&E for 9 hours waiting for them to find a bed, because there were no beds in York and no beds in the whole of the northeast of England, and they were thinking they might have to send me from York to Manchester or something. But eventually they found a bed in a private hospital about 20 miles away.
Well, Professor, I hope you've been able to hear Kerry's story. It's so harrowing, hearing one person's tale. Is it something you've seen a lot, you hear of a lot?
I think unfortunately it's becoming more and more common, since there has been a reduction in beds over the last 2 or 3 years. And this reduction seems to be based on that, we don't need beds, but we need community care. I think we do need both. It's a very complex situation, because we do need appropriate social care for people. We need daycare, we need beds. Sometimes people do need asylum away from the stresses, and so they can come in, sit down with their therapist, work things through.
You say that the closure of beds is linked to the well, I don't know, is it an increased provision of community care services? I mean, have the beds been closed before the alternatives have been set up?
I don't know the exact reasons, but what I'm hearing around the country is that the investment is moving from beds to community care. The point really is that beds are an expensive commodity, and it costs about £450 a night. And it is absolutely vital that we do need a specific number of beds, so that when patients need admission, they can be admitted rather than being shunted around looking for beds, and lots of managers and clinicians wasting their time trying to find a bed.
Well, Kerry, I saw you shaking your head a couple of times during that, talking about local provision, community provision. We're going to be speaking to Norman Lamb a little later on. I mean, I just want the Care and Support Minister, what would be your direct message to him about what happens in the real world?
Well, in the real world, the mental health funding is being cut when there's a recession, and we know that there's more need for mental health support. And that in York, for example, then they're about to close St Andrew's Psychotherapy Centre, which does a sort of clinical psychology work that can get people really well and not needing help anymore. The early intervention service I use is no longer funded for a clinical psychologist. The sort of services which keep people well in the community are being cut all over the place, and that's really a false economy because it means people need more intensive support later on.
Professor Dinesh Bhugra, would you agree with those points? What would you add?
I think I'm a great admirer of Norman Lamb, and I think he's doing a very good job under very difficult circumstances. I think the challenge for all of us is the Treasury. The Chancellor needs to make sure that there is enough funding coming through to mental health services so that people can access services when they need it, where they need it, rather than going around the country on a bed hunt.
And Professor, I hear what you say about Norman Lamb. Your experience with other MPs, I mean, has people's attitude, do you think MPs' attitude, given that they are the ones who are making these decisions about mental health, changed at all? What experience have you had?
I think that there has certainly been a shift, and the fact that in June this year lots of MPs stood up in the House and talked about their own personal experiences of mental illness was quite refreshing and an absolutely superb way forward. The government has signed up to parity of esteem between physical health and mental health. Now the time is for action. You know, words are not enough.
As I understand it, though, you have encountered one MP whose attitude shocked you. Is that true?
Well, yes, one MP basically said that we don't need psychiatric services, and you know, people should just pull their socks up and get on with their lives. And you know, my invitation to him that come and see psychiatric services in the Maudsley went unheeded.
Kerry, when you hear people saying it's just a matter of pulling yourself together, what do you think?
There's so many terrible attitudes towards mental health in this country. For example, at Thorpe Park at the moment, then there's a ride called The Asylum, which features mental patients who would chase you around with chainsaws, and I think that's awful. But people don't understand that mental health problems are really common. They can affect everyone, and that we just need a bit of help and support to get on with their lives.
Do you feel you're getting adequate support now?
Yes, I cannot say enough good things about the early intervention and psychosis team in York who I see, but that's only a time-limited thing, and I'm very worried what will happen when I stop seeing them. And across the country, then services like early intervention and psychosis, which in York cut sectioning rates by 80% in the first year it was used, being gutted.
Well, Kerry, really appreciate you coming and telling us your story. Thank you so much. And Professor, thank you for your time this morning as well.
Yeah.
Thank you.
And as Charlie mentioned, we will be speaking to the Minister responsible, Norman Lamb, in about half an hour.
Time now.